Hello, I'm William A. Van Horn, MD, a geriatric neuropsychiatrist who specializes in dementia, all forms of dementia, Alzheimer's dementia, vascular dementia, Lewy body dementia. And today I want to talk about brain energy issues with Alzheimer's patients. This is an area that's really lacking as far as treatment throughout our country. About 15 years ago, I went into Emory University to become an Alzheimer's expert. One of the top programs in the country. Brilliant doctors, wonderful professors. And I think it was the first week I was there, one of the top doctors in the world said the #1 neuropsychiatric issue with Alzheimer's patients is apathy. Now, a neuropsychiatric issue means the issue they have. It just means apathy means they don't want to do anything. And I said, really? And I said, you know, if they were 45 and they had apathy, we would call it a chemical depression, and we would give them a brain energy medicine. I said, why don't we do that with Alzheimer's patients? Said, well, the studies have never been done to show that it helps. In fact, at that point, one study had been done. It was using a medicine called Zoloft, which just raises a chemical called serotonin, and that showed that it benefited Alzheimer's patients. Now, the real energy chemical in the brain, or one of the main energy chemicals in the brain, is called norepinephrine. There's not been a study done that I know that raises norepinephrine in the brain of a person with Alzheimer's. So when I left Emory after my year of training, I had one of the largest practices in the country for dementia. Inpatient and outpatient, saw hundreds of patients a month. And consistently, particularly the advanced Alzheimer's patients, they were all tired. I said, well, why not give them a brain energy medicine? So I would give them a medicine that's labeled antidepressant. And the family would say, why are you giving my mom an antidepressant? She's not depressed. And I'd say, just change the paradigm. This isn't for depression, this is for brain energy. One of the problems we have in the field is we label physical illnesses of the brain with psychological terms. So a lot of people who have low brain energy are not emotionally depressed, as with Alzheimer's patients. So I started putting all of my Alzheimer's patients, even my early memory loss patients, on brain energy medicines. And the one I liked a lot is a medicine called venlafaxine. And it basically raises 3 chemicals. One's called serotonin, as I mentioned before. Serotonin, when it's low, you become more anxious and feel more down. The other chemical, called norepinephrine, when it's low, you don't have energy, you don't have concentration, you don't have zest. Does that sound like possibly your family member? And then the third chemical is called dopamine, and when you're low on dopamine, you don't feel pleasure. Well, it's well established that patients with advanced Alzheimer's don't have much energy, they don't have good concentration, they don't experience much pleasure, and a lot of them are anxious or irritable. So why not raise those chemicals? So I started aggressively raising the chemicals. Another thing that was really important that I found, and you gotta understand, I did this with thousands of patients, so it wasn't small numbers. The other thing I found was the basic theory about treating an older person is that because their kidneys don't take the medicines out of their system as fast as they should, or their liver doesn't break them down as fast, you give them less medicine. Well, what I actually found was that because their brain is so decayed, like basically what's happening with dementia is your brain is dying from your 20s, 30s, all the way up. So the time you're 80, your brain's really fragile. And it's lost a lot of that chemical strength that you need to function. So what I found, not only did they not need less, they needed more than some average people who were 50 because they needed more chemicals to replace the ones that were missing. And the benefits were profound. I can honestly tell you, without question, at least 90% of my patients who suffer with advanced dementia are happy and awake during the day and sleep at night. I was at a conference, an Alzheimer's conference in Wilmington, North Carolina. And before I spoke, I was one of the guest speakers, before I spoke, a man got up there, a really sweet man, who had filmed his aunt who had Alzheimer's over 4 years. And he basically showed the film and just talking about the suffering of Alzheimer's. And I sat there for 30 minutes and watched with my wife, and I said, this is so sad. That's not my patient. She did not smile a single time in that 30-minute film. Not a single time. I can tell you right now, you walk on my unit, you walk in my outpatient office, and you see my Alzheimer's patients, they're either laughing and smiling or I'm adjusting their medications. If you have a loved one who has Alzheimer's and they're tired, don't have any energy, they're sleeping during the day, and they aren't experiencing pleasure, aren't happy, that can change. Go to warwithalzheimers.com and learn more.